Hello, Dr. Vikki Petersen here. I want to talk to you today about mold toxicity. And this is something we're really just coming to appreciate how pervasive it is. Although I was reading a book and it said that mold was first described in the Bible. So clearly we've known about mold for a long time, but that doesn't mean it's gotten mainstream in research, or if you go to see a doctor, most doctors don't know too much about it nor how to diagnose it. So what have we learned about mold? It's, as I said, very pervasive, and it's interesting that the organism itself, so it's called a biotoxin because it's alive, right? Mold is a live organism, versus like a heavy metal is just called a toxin, no bio, because it's not alive. So it's a biotoxin, and what's interesting about it is it has a side to it that's fat soluble, meaning going through fatty structures, and the other side of it is water soluble, which means it can go anywhere in the body, which a lot of things can't, and then it can be hard to get rid of. So the percentage is that 75% of people can deal just fine with mold. It comes in, they make antibodies against it, they destroy it, out it goes, we're all good. But 25% of us can't, so that's a very, very high percentage. And when you're looking at the symptoms associated with mold, they are long. Now, there are 3 that are what's called pathognomonic, and in medicine that word means that when that is present, it is likely indicating X, Y, or Z disease, right? So what's pathognomonic of mold is, one is electric shock-like sensations. Another one is ice pick-like pains. So these are very dramatic. And then the last one is a vibration or pulsing feeling, either up and down the whole spine or in segments of the spine. So hearing these, doctors should think about mold. But along with that, I'm going to look down at my notes because it's a very long list, are things like headaches, muscle weakness, numbness and tingling that a neurologist would kind of dismiss because they don't necessarily follow the pattern of a nerve, but the patient is still feeling it. Dizziness, disequilibrium, so feeling like you're out of balance, anxiety, depression, fatigue, cognitive impairment, so the brain is not working as well as it should, joint and muscle pain, also tics and spasms, seizure-like phenomena, headaches, I think I mentioned, GI symptoms, chest tightness and pain. As you can see, very long list, and certainly indicative of other things as well, but this is the list. Body temperature dysregulation, so we hear about that. I hear about that frequently with patients, and it's like I run hot, I run cold. Patient just said that the other day. She's like, I can't seem to hold my body temperature. It's like if it's really cold, I'm freezing. If it's really hot, I'm super hot, like my body can't equilibrate itself. So definitely made me think of mold. But too often patients are, because their problem can't be found as sort of a disease, they're put in the, well, it's stress, it's all in your head, and here's a psychiatric medication for you. So it's very, very misdiagnosed and unappreciated, the symptoms associated with mold toxicity. Interestingly enough, in children, the symptoms can manifest like ADHD. And I mentioned fatigue. Obviously, fatigue is very pervasive and associated with a lot of conditions, but they did an interesting study and found that 93%, it was over 100 patients that were diagnosed with chronic fatigue, that 93% of them had positive mold. So this mold can go along with and be that root cause of a lot of these problems that people are suffering with, creating this long list of symptoms. So mostly mold is inhaled, but you can touch it and comes through your skin. You can ingest in this form of certain foods that are moldy, but mostly it's the inhalation that is most problematic. What else did I want to tell you? I was just talking to my trainer today. She's young and she was just having a lot of cognitive problems. She's trying to go to school. At the same time, she's a personal trainer. She's having trouble concentrating. She goes, I'm just having so much trouble in school. And I know she lives in an older home. We've, talked a little bit as she trains me. And I said, have you seen any mold in your house? She said, oh, yes. She said, my grandmother owns the house and the bathroom is full of mold. And she said she wants me to clean it all the time. And if you're sensitive to mold, the last thing in the world you want to do is clean it in a bathroom, etc., because you're going to get it out into the air even more, even if you're wearing a mask, not good enough. So that's the last thing. And I said to her, so you're at home, sometimes, obviously you're away from the home or maybe going away. I said, do you notice anything different? She goes, I always feel guilty about it. She says, I don't want to tell my grandmother and hurt her feelings, but I always feel better when I leave the house. And I'm like, okay, let's get you a mold test. We recently had a patient who, he's recently retired. Well, retired probably about 5 years. 4 years ago, he was diagnosed with kidney cancer, and then this past year diagnosed with dementia. Also lives in a very old home. He and his wife knew the house was moldy, but only in the basement is what they said. And so they don't go down there much, but when they do, they can smell the mold. Not realizing it's inhaled, it's going through the air, and it doesn't matter that they just smell it more in the basement, it's still everywhere. And the mold that we found on him, he found very high mold levels, but the particular mold was associated with kidney disease and dementia, and here he had both of them. Now his wife, once again, living in the same house, no symptoms. So she's actually had some problems as well, but not specifically to the mold. So she's in the 75%, he's in the 25%. So it can be hard in the family if 1 out of 4, people is reacting, and then you test for mold, and it's like, well, how can that be real when the rest of us are fine? So just remember, that's the ratio, 25% can't detoxify it. So it's a very real problem. And we also used to think, boy, more in moist, hot climates. We're building a clinic in Florida right now, and I'm thinking, oh my gosh, what's that going to be like? Because I know it's super moldy there, but here we are in Northern California, Silicon Valley. It's not wet, it's not particularly hot, yet we find a ton of mold. So it's more in that leaky, something in the bathroom leaking, etc., down in the basement. So it happens. It doesn't have to be the climate that's fostering it, although certainly worse in those type of environments. So what we do is we test you for mold. There's a test. It's a urine test, and so it's very easy to do. And then we can test your home or your office, depending. And we also used to think that you just had to get the person out of the environment and that was enough. It's not. The mold really gets into the sinuses, into the gut, and can be a little bit resilient there, and not so easy to get rid of. We do have a program that works. It's very natural, and it attaches onto it, and you also have to make sure that the gut is processing the toxins, and the liver and the gallbladder are working well. So it's a bit of a process, but it's natural, and oh my gosh, the difference it can make in your health. So if you feel that you might be someone who is suffering from this, please reach out. This is something we're good at. Again, very natural, and certainly easy enough test. It's just a urine test to find out if it's something that's contributing to your ill health. So I hope you found this valuable. Please share this video with others. And if your health is not the way you want it to be, please reach out. Give me a call. The telephone number here is 408-733-0400. I look forward to talking to you.